ECG intervals, segments, and the U-wave. Introduction. This video will clarify the difference between ECG waves, segments, and intervals. These terms are sometimes used interchangeably, but they describe different parts of the ECG tracing. Video will examine the PR interval, PR segment, QRS duration, ST segment, QD interval, TP segment, and the sometimes visible U-wave. Waves, segments, and intervals. A wave is a visible deflection above or below the ECG baseline. Examples include the P wave, the QRS complex, the T wave, and occasionally the U wave. A segment is the portion of the tracing between two waves or complexes. It is usually relatively flat and close to the isoelectric baseline. An interval is a measurement of time that includes at least one wave or complex and may also include one or more segments. A helpful analogy is to imagine a road trip. A wave is an important event or landmark. A segment is the road between two landmarks. An interval is the entire measured journey, including a landmark and part of the road. Why a segment may look flat. A flat segment does not necessarily mean that nothing electrical is happening in the heart. The ECG records the combined electrical differences between regions of cardiac tissue. When large areas are in a similar electrical condition, there may be little net voltage difference for the surface electrodes to detect. The tracing, therefore, remains close to the baseline. This is especially important when understanding the PR segment and the ST segment. The heart is still conducting electricity or maintaining a depolarized state, even though the ECG line may appear flat. The PR interval. The PR interval begins at the start of the P wave and ends at the beginning of the QRS complex. It includes the P wave, the PR segment, atrial depolarization, and conduction through the AV node and the ventricular conduction system until ventricular depolarization begins. A normal adult PR interval is approximately 0.12 to 0.20 seconds, which equals 3 to 5 small boxes on standard ECG paper. A prolonged PR interval may indicate delayed AV conduction, such as first-degree AV block. A shortened PR interval may occur when the impulse reaches the ventricles through an unusually rapid pathway. The PR segment. The PR segment begins at the end of the P wave and ends at the beginning of the QRS complex. It mainly reflects conduction through the AV node, the bundle of His, and the early ventricular conduction system. The delay at the AV node gives the ventricles time to fill before ventricular contraction begins. The PR segment is normally close to the isoelectric baseline. Remember the distinction. The PR interval includes the P wave. The PR segment begins after the P wave ends. QRS duration. The QRS duration is measured from the first deflection of the QRS complex to the point where its final deflection ends. The first deflection may be a Q wave or an R wave. Not every QRS complex contains all three named waves. The QRS complex represents ventricular depolarization. Its normal duration is generally approximately 0.06 to 0.12 seconds. A widened QRS complex may indicate delayed conduction through the ventricles, such as a bundle branch block or a ventricular rhythm. The ST segment and J point. The point where the QRS complex ends is called the J point. The ST segment begins at the J point and ends at the beginning of the T wave. During this period, the ventricular muscle cells are largely and relatively uniformly depolarized. Because there is little net electrical difference between ventricular regions, the ST segment normally remains close to the baseline. The ST segment corresponds to the plateau phase of the ventricular action potential. Elevation or depression of the ST segment can be clinically significant, but it must be interpreted in several leads and in the context of the patient's symptoms and condition. The QD interval. The QD interval begins with the first deflection of the QRS complex and ends when the T wave returns to the baseline. It includes the QRS complex, the ST segment, and the T wave. The QT interval therefore represents the total time required for ventricular depolarization and repolarization. It changes with heart rate. It normally becomes shorter when the heart rate increases and longer when the heart rate decreases. For this reason, clinicians usually evaluate the corrected QT interval called the QTC. A prolonged QTC is important because it can increase the risk of dangerous ventricular dysrhythmias. Remember, QRS equals ventricular depolarization. T wave equals ventricular repolarization. QT includes both processes. The TP segment. The TP segment begins at the end of the T wave and continues until the beginning of the next P wave. During this period, ventricular repolarization has been completed and the heart is between electrical cycles. The TP segment is often considered the best representation of the true isoelectric baseline. It may become very short or disappear when the heart rate is rapid because the next P wave begins soon after the preceding T wave. The U wave. The U wave is a small deflection that may appear after the T wave. It is not visible on every normal ECG and is often easiest to see in the middle chest leads, particularly V2 through V4. Its exact physiological origin remains uncertain. Possible explanations include delayed repolarization of Purkinje fibers, papillary muscles, or other ventricular structures. Therefore, it is safest to say that the U wave may represent late electrical recovery, rather than assigning it one proven source. A small upright U wave can be a normal finding, especially at slower heart rates. Prominent U waves may be associated with hypokalemia, bradycardia, or certain medications. An inverted or unusually large U wave may require further clinical evaluation. Final summary. Let us review. A wave is a visible electrical deflection. A segment is the usually flat portion between waves. An interval is a timed measurement that includes one or more waves and may also include segments. The PR interval measures from the beginning of the P wave to the beginning of the QRS complex. The PR segment lies between the end of the P wave and the start of the QRS. The QRS duration measures ventricular depolarization. The ST segment extends from the J point to the beginning of the T wave. The QT interval includes the complete period of ventricular depolarization and repolarization. The TP segment lies between the end of one cardiac cycle and the beginning of the next. Finally, the U wave is an occasional small wave associated with late electrical recovery, although its exact origin remains uncertain. The easiest memory phrase is, waves are electrical events. Segments connect the waves. Intervals measure how long the electrical processes take.